Hello, welcome to Skool, my page about my journey with skin cancer. Do I know what I'm doing? Nope. So bear with me, be patient. I am just being myself. So let's get started. Welcome to my first video in my skin cancer treatment series. I'm going to be sharing my real, honest experience with using Fluorosil 5% cream, also known as a chemo cream. A lot of people feel nervous before starting this treatment, so my goal is to break everything down in simple language and show you what it actually looks like along the way. So what is this cream? This cream is basically a topical form of chemotherapy, but don't worry, it only affects the skin where you apply it. It is designed to target and destroy precancerous and damaged cells, especially those caused by years of sun exposure. So if you look at me, you will see my chest is not pleasant. It's got a lot of sun damage, rough spots. I have been dealing with skin cancer for now, oh gosh, I'm in my 50s, late 50s, and it was 27. I was 27 years old when I had my first basal cell, which was located on my back. Since then, every part of my body has had surgery except for my face and my left arm. It's the only place where I have not had the Mohs surgery for basal and squamous. But I do have a lot of sun damage and precancerous and damaged cells on my face. As you can see, this is me without my makeup. I did do a treatment yesterday, so this will be the second day, and I'm going to be putting on the cream here in a few minutes, but you'll see me here without makeup, my hair not done, and this is what I look like. And I do have sore skin, meaning it's sore to touch just because I have a lot of raw areas, dry, patchy areas, a lot of precancer, uneven skin tone. The list just goes on. So I wanted to break down what this cream is. And everyone should read the insert, but then when you read it, you have no clue what they're talking about. So I kind of want to break that down. So how does it work? It attacks unhealthy cells because they grow faster than the normal cells. When it gets inside them, they can't reproduce anymore, so they simply die off. That's why the skin gets red, crusty, and irritated. It's literally the damaged cells dying and falling away. It's not pretty, but it's a sign the cream is working. So I'm anxious to see, 15 years ago, approximately around that time, a long time ago, I did this on my face, and my face looked horrible. I had so much precancer and damaged cells that my face looked like I had third-degree burns all over my face. And I actually had to stop working because I was scaring people, especially children would hide behind their parents. They would cry because I looked scary. So I'm anxious to see, because the more precancerous cells you have, the more damaged cells that you have on your face, and you're going to use this treatment, the worse it's going to look and feel. So I'm going to, I didn't save any pictures. I may have an old YouTube video to kind of compare to see what this looks like compared to now 15 years later when I'm 57 years old. So we'll see. What it's used for is doctors usually prescribe it for those dry, rough, sun damaged spots, and then some early small basal cell skin cancers, but mainly it's for precancer. If you have basal cell, you really should have it removed, and I recommend the Mohs surgery, and we can talk about that later. This cream helps remove those cells before they have a chance to turn into something more dangerous. So if you use this cream, or if you've been prescribed this cream, or if you're wondering if you should do it or not, let's be honest, this treatment gets ugly before it gets better. So what you're going to see, and I'm going to make videos, maybe not daily, but every couple of days, so you can see how my skin is going to change, and I'll tell you how I'm feeling, and so forth. Definitely there's going to be some redness, burning, itching, peeling, crusting and sensitivity, and swelling. Everyone reacts differently, but almost everyone looks worse before they heal. And that is normal. So the safety things that you need to know, and that comes down when the doctor may not explain things because any more doctors get you in and get you out. And since I've used it before, I do have some important points. You do not want to get this in your eyes, mouth, or nose. Don't use it on your eyelids. Wash your hands after applying it. Avoid sunlight. And don't use it if you're pregnant or trying to become pregnant. That is very, very important. It will do harm to your child. So, the reason why there's other things that you want to keep in mind, and I want to tell you from the mistakes I made before. You want to avoid around your mouth really close, because opening your mouth and shutting it, smiling, is going to be very painful. So you want to avoid that area. The crease right in here, again, because of speaking, these areas move, and you don't want to get in any kind of creases that you see on your face, especially around your eyes too, because you're squinting. And again, there's a lot of movement. So you want to avoid those. Now that I'm 57 versus being like 40 when I done it the last time, I know this is embarrassing, but because of my hormones and having hormone implant, I grow a beard. Yes, I grow a beard right here, and it comes in thick and fast. I am definitely not going to put that cream there. Can you imagine having like a 3rd-degree burn and seeping sores and trying to shave? Yes, I do have to shave every day. I should shave twice a day, but every day. There's no way. So I have to choose. Do I want to do this treatment and grow a beard on top of looking horrible? No. So I am going to avoid this area. So why am I sharing this? This process can feel intimidating. And when you search online, you often see only extreme cases and can scare you. And you say, no, I am not doing this. My goal is to give you a real balanced look at the journey from the early days to the peak reaction to the healing stage, and that we all come together, have some fun, talk about it, and really focus on positive thinking and your state of mind of dealing with being uncomfortable. And also, you have to get over that stage of knowing that you are going to look bad and people are going to stare. But when you get older, you realize, who cares what people think about you? But there are younger people in their 20s and 30s that they're not at that age to where they don't care. They do care what people think. So this is the start of my journey. And so in the next videos, I'll show you my skin daily or weekly progress, talk about the side effects and share tips that help with the discomfort if you're going through this too. You're not alone. There are some other things that I wanted to talk to you about, and darn it, I should have prepared for this, but what is really important is basically, many people don't read that insert. So what I suggest is when you have medication, use AI. Take that insert, because it talks in medical language that you don't understand. Scan it and then ask AI to break it down in a language that you do understand. So using this, it can kill your pets. And so you need to know this. You do not want to leave this out for your animals to get a hold of, especially if you have like puppies that want to chew on things. But this is so toxic to animals when you put it on. And if you have an animal, a dog or a cat that likes to lick you, if they lick it after it's been on your skin, it can be fatal. So you need to know that. And the doctors are probably not going to tell you. My first box did not have that warning on it. At least it has the warning right on it for you to know. So anyways, just make sure that you read that. And if you need help, just use AI. So anyways, I'm going to go ahead and put this on, and you really should. And also, it says, I don't know why, that you cannot use a metal application tool to put it on. They say certain gloves should be used, but they don't say what kind of gloves. So I'm just going to use my fingers. But it's crucial that you wash your hands and make sure that you have it off, because it's not good if you rub your eyes and stuff. And so anyways, you want to use a third or a thin layer. Sorry. I gotta take off my glasses, so I'm going to be blind. And okay, I can see myself. Yeah. So you just want to use a thin layer. Oh my gosh, this is hard to see. Oh, I just look attractive. I can already tell. Oh shoot. I think I'm only going to do half of my face and do the rest in front of a mirror where I can see with my glasses. Hell, I'm just going to put my glasses on, because I have to avoid certain areas from my mistake the last time of being too painful. But again, just a very thin layer. And I know where I'm going to break out the worst, because I can feel it. Oh, shoot, getting too close. Is right here. I can feel the bumps and getting a little bit more tender. So anyways, I don't think you want to watch me, but definitely don't go up around your eye. Definitely do not go around your nose and your lips, unless you have to, because if you have troubles there or had cancer there previously, then of course you're going to have to do it. But I am not. Another thing is, I didn't realize it's supposed to be kept, the cream, in a temperature around 77 degrees. And I'm hoping my cream's okay, because I was keeping it in my closet away from the animals. And it's so weird, because my closets in my home are not insulated. So if it's wintertime or it's cold out, it's freezing. Literally, I have to have a coat on to go into my closet. Does anyone else have that problem? So it's been kept in there, because I did not start this. I was supposed to start it last March, and I didn't, because, oh my gosh, you can't see, but I have tons of little bumps and dry patches and sores. It's just tender to touch my skin. Anyways, so when I grabbed the cream out of the closet, it felt cold. And so, anyways, I have to move it. And I guess my skin is so bad. Guess how many refills? They said I have to do this every year. Only do this in the winter. I advise that you do not do this treatment unless you really, really have to in the summer, because you're going to have to stay inside. You cannot be in the sun. I think I put enough on. So basically, I'm going to put a little bit on my nose. But not between my eyes, because I am very expressive, as you see when I talk. So I'm just going to do this much. I am done. Remind me, wash my hands. Oh gosh, I just look attractive. Anyways, I forget what I was saying, but it definitely needs to be kept in kind of a warm area. So anyways, that's what I do. I have to do this once a day. Oh, we were talking about refills. So I now have to do it every single winter. So I'm going to do it between, it's going to take 4 months, because it's 2 weeks on. You do it once a day for 2 weeks. Then I take a break for 2 weeks to kind of heal a little bit. Repeat it, not heal, just take a break from it. Then repeat it for another 2 weeks. Then after that, that's when I'm going to look my worst. It is going to take anywhere from a couple of weeks to a couple of months to for it to clear up and for the skin to peel off and to have new skin. It does make you look a little bit younger, so that is the good thing about it. When I get done with that, I have to move to what's even worse, my chest. And that same thing, you do it daily, 2 weeks on, 2 weeks off, repeat. and then again could take 2 weeks to several months for it to clear up. I'm going to be honest. I tried this because this is where I've had the most removed, and you see my scarrings. I don't know if you can see my past surgeries, but this is the most damage that I have, and that's why I look so old, and my neck looks so old. But it hurts. It really does hurt. So I told the doctor I chickened out the last time I did. My face I can handle, especially if you avoid where your skin moves a lot. But here, especially if you have a chest and the clothes touching it, when you roll over in bed and you have some movement, it hurts because that skin is so raw, just like if you had a 3rd-degree burn, worse than a bad sunburn. So I asked the doctor, how am I going to get through this? And she said, it's going to take a lot longer, but just do little sections at a time. So if I broke this down from here to here to here to here, it is going to be months through that treatment. But it's something I have to do because this is my worst area. So I'm going to do that. So that's the reason why I'm going to start as early as October, November every year and run through March of treating my skin. So most people just get one refill to do it, and I have 40 refills to get me through for a year. I hope I don't have to use 40 of those, because my other doctor wanted me to use it kind of all over my body. It's just too much at once. You really have to break it down and do prioritize what's worse. I do have issues on my legs now, and some on my arms, but really I'm fine waiting on that. So anyways, this is becoming too long. So if you want to follow this and join me and tell me about your experience, this is private. So therefore, if you share photos of the other people, I think, on how this works, is not going to see that. So I will be back in a couple of days for you to see the difference. Talk to you soon. Thank you.